Around 10% of men and 9% of women have been diagnosed with some form of heart or circulatory disease. But what symptoms can we look out for that might indicate a potential heart problem? David Newby tells us more about 10 signs that could mean it's time to see a doctor. Number 1. Chest pain. It's the classic sign of a heart attack, yet many people don't realize this could be a medical emergency. Professor Newby says, if you have chest pain and you feel extremely unwell, you should dial 999 and get an ambulance as soon as possible, if it's a heart attack. It's usually described as a heaviness, tightness, or pressure in the chest. People will often describe it as an elephant sat on my chest, or it felt like a tight band around my chest, that sort of constricting feeling. If chest pains occur when you are exerting yourself but go away when you stop, that would suggest it's more likely to be angina. That would still mean you should go and see a doctor, but you don't have to call 999. Number 2. Feeling sick. Obviously, not every bout of nausea equals a heart attack. But if you are getting pain as well, alarm bells should ring. The feeling usually lasts longer than a few minutes. It may happen when you are at rest or when you are doing something physical. If you are getting some discomfort but not intense pain as well as feeling sick, call your doctor. Number 3. Nausea or stomach pain. Some people have these symptoms during a heart attack. They may even vomit. Women are more likely to report this type of symptom than men are. Of course, you can have an upset stomach for many reasons that have nothing to do with your heart. It could just be something you ate after all, but you need to be aware that it can also happen during a heart attack. So if you feel this way and you are at risk for heart problems, let a doctor find out what's going on, especially if you also have any of the other symptoms on this list. Number 4. Feeling sweaty. Working up a sweat when you've been to the gym or because it's a really hot day, it's nothing to worry about. But feeling hot and clammy along with chest pains is a sign that you should call an ambulance. Number 5. Throat or jaw pain. Throat or jaw pain probably isn't heart related. More likely, it's caused by a muscular issue, a cold, or a sinus problem. But if you have pain or pressure in the center of your chest that spreads up into your throat or jaw, it could be a sign of a heart attack. Number 6. Arm pain. You might not associate arm pain with your heart, but it can be a sign of a heart attack. If your pain is going down the arm, especially the left arm, or into the neck, that makes it more likely to be heart-related than indigestion. If it doesn't go away, or if you know you have heart disease and have used your GTN spray 2 or 3 times to no discernible effect, you should be seeking emergency medical advice. Number 7. Choking sensation. The word angina actually means choking, and sometimes the tightness or pain can be up in the throat. People tend to describe a restricting or choking sensation. If the feeling continues and you haven't previously been diagnosed with heart problem, but if you have some of the other signs listed here as well, it might be safer to call an ambulance. Number 8. Snoring. It's normal to snore a little while you snooze, but usually loud snoring that sounds like a gasping or choking can be a sign of sleep apnea. That's when you stop breathing for brief moments several times at night while you are still sleeping. This puts extra stress on your heart. Your doctor can check whether you need a sleep study to see if you have this condition. If you do, you may need a CPAP machine to smooth out your breathing while you sleep. Number 9. A cough that won't quit. In most cases, this isn't a sign of heart trouble, but if you have heart disease or know you are at risk, pay special attention to the possibility. If you have a long-lasting cough that produces white or pink mucus, it could be a sign of heart failure. This happens when the heart can't keep up with the body's demands, causing blood to leak back into the lungs. Ask your doctor to check on what's causing your cough. Number 10. Your legs, feet and ankles are swollen. This could be a sign that your heart doesn't pump blood as effectively as it should. When the heart can't pump fast enough, blood backs up in the veins and causes bloating. Heart failure can also make it harder for the kidneys to remove extra water and sodium from the body, which can lead to bloating.